based our registration, we based the space tonight on the amount of registrations we received to be here in person, which was closer to the number 50. As long as we don't exceed 88, we're gonna be okay.
But it's so great to see everybody out. Thank you so much for coming.
All right, so. Folks, we're gonna get started, okay? For the folks who are coming in, just take your time, come in and, find a seat, make yourself comfortable. My name is Frank Isley. I am the executive director for the Indian River County Hospital District. Is that how you might make it sound? What's your code? Check. My name is Frank Isley with the executive director for the River County Hospital District. So just a curious show of hands. Does anyone know what the Indian River County Hospital District is or what we do? High hands, please. Okay, all right, that's not, all right, more than I expected. Thanks very much, I appreciate it. For those of you who don't know, the Indian River County Hospital District has been serving Indian River County for 65 years. And what we do ultimately is help ensure that Indian River County has the healthcare it needs and folks have access to that. So that includes moms who are expecting a baby, and that's what we're here to talk about tonight. Another show of hands. Are you aware that Cleveland Clinic Indian River Hospital is the only hospital in our county where moms can deliver babies? All right. Okay, so for those of you who don't know that, now you know. So, we don't have a huge county, but for 170,000 people, we have one hospital that delivers babies, and we've done that for some time. Now, as part of the hospital district, part of the work we do, we monitor trends. So we look at trends and see what's happening in the nation. And with the focus being on maternity, some of the trends we're seeing is closures of labor and delivery services. Echoing anywhere else, but. Class. Can everyone hear me okay? Yeah. Okay, it's not too distracting. Yeah.
Challenges, starting here.
So in monitoring labor and delivery services nationally, one of the things we're seeing is closures. And there's several reasons for that, which our expert panel can talk about. But most recently, Cleveland Clinic, Martin North, with their closure, kind of prompted us to think, okay, this is a national trend. This is a Florida trend. And in our county, in surrounding counties, if we're seeing this trend, let's make sure we get ahead of it. Now, Cleveland Clinic Indian River has given us no indication that they're going to discontinue these services. I just want to be clear on that. However, if you watch the trends, and we're aware of some of the losses by Cleveland Clinic Indian River related to the whole OBGYN service line, it's concerning. So our district trustees wanted to get ahead of this and just start having a discussion about what this would look like in our county, and if there's any way we can work on a sustainability plan to make sure that, for all the reasons other hospitals are closing labor and delivery, we don't. So a big part of this is hearing from our community and hearing from you, because what we're trying to determine right now is, with the hospital facing these losses, should the district help ensure that these services remain open for the foreseeable future? And should the district contribute tax dollars to ensure these services are here and they're viable, for moms? And this number we're talking about is spending up to $3.5 million a year on this. Now, in addition to holding these town halls, we wanted to make sure we heard from as many people in the community as we could. So we have a countywide survey going on right now, which is a telephone poll survey. And we will have the data from that this week. And we'll combine that with the comments and the questions and the feedback we get from 3 town halls. We're here tonight. Tomorrow we're in Sebastian. And then on Thursday, we're at the Gifford Youth Achievement Center. And so we'll collect that data, we'll present it to the trustees as part of the discussion on should we use tax dollars for this. Asking the community makes the most sense. So we're joined tonight by our panelists, and I'll go down the row here. Megan McFall is the CEO with Indian River County Healthy Start. We have Dr. James Presley, a longtime OBGYN in our community. We have Carissa Wright, a nurse practitioner at the Caring Center for Women. And of course, last but definitely not least, we have Mary Volsky. Does anyone know Mary Volsky? Is she at? So she is nurse manager of OB at Cleveland Clinic Indian River, and she's been there for, I think you said the other day, 36?
No.
All right, sorry.
Whoa. 31 years at the hospital, 25 in maternity services.
Okay, so 25 years in maternity services. We also have with us here tonight, I'm sorry about the mic. I just want to recognize we have a few of our trustees here. So we have Michael Kent. Michael, if you could just please stand and just acknowledge Michael Kent. We have Terry Bartlett, who's standing in the back. And we have Paul Westcott, who's also standing in the back. Now, we have 7 elected unpaid trustees who work very hard to ensure healthcare access and affordability in our county. It's a real tough job, and they've been working very hard lately. So we're happy to have them here and glad to have this discussion. So on the way in addition to the snacks and the sign-in and the name tags, we had a post-town hall survey, which did a lot of people pick up? Okay. So you can scan, there's a QR code on the survey that you can scan with your phone, and you can fill this out online. So for the folks listening and watching on Zoom, they can use the QR code also. They have, we want to hear from everyone. And the way we're going to do the questions is if you have a question or a comment in the audience, please raise your hand. If it's someone on Zoom, please do the same. And Shannon and I will make sure, we recognize those folks and hear their comment or question. And we're going to start by allowing one question or comment per person, and we're hoping we can keep each of those to about a minute. Obviously, this event goes to 7 o'clock, and if I get everyone in here, we're just never going to have time to get to everyone. How many folks do we have on Zoom?
We have 31.
Okay, so altogether, we probably have 60, 70, 100 people. So I just want to give everyone a chance to speak. But the beautiful thing about the survey that you picked up in the, when coming in is you can scan it and give your feedback online, okay? So the purpose of this discussion tonight is really a 2-part question. The first is, do you think it's important? Do you think it's important for expecting moms to have labor and delivery care close to home? So that's the first part of the question. The second part is, would you support using local tax dollars to help keep those services available while we work on a long-term solution? So, those are the questions, and that's what we really want to hear what you have to say about those questions, okay? And again, we're doing this for you. I mean, this is very important input. We want to make sure, the district want to make sure that we serve the community as best we can, and asking the public how they feel about these services is an important part of it. So thanks again for being here, and we'll get started. So please state your comment or question, and if you could state it, if it's a question, please comment, just raise a hand and we'll come around with a mic and you can state it. If it's a question, please direct it to me and then I'll direct it to one of the panelists. Okay, so let's get started. Whoever, thank you.
Good evening. My name is Nancy McLean. I'm a labor and delivery nurse at Cleveland Clinic Indian River. I've been with the hospital 16 years, in labor for 15. My concern is, I know the money is an issue, but I think one of the things we need to consider is if we do close our doors, what is going to happen and what is the cost going to be for the women who now have to travel possibly 45 minutes or longer to have their baby. The emergencies that are gonna occur, not only with home births that don't go the way they should, that come rushing into our facility, to hemorrhages, diabetic crises, preeclamptic episodes. There's a lot of things to consider. And is our emergency room going to be able to handle those crises? And what is our maternal death and our baby death gonna be if those crises aren't handled appropriately? So I think that, 3.5 million is a lot of money, but I think in the end, we need to look at what the ultimate cost could be down the road if we don't have our doors open anymore. And I think that we need to look at the other counties that have closed their doors, how far those hospitals are, and what crises they've endured because of those closures.
Appreciate that. Thank you. Thank you very much.
Along those same lines, I'm a big supporter of life and very involved with the Caring Center for Women. And I just want to say, we have people in this community that don't have access to the transportation to get to these other facilities. It's so important to support these moms and give them the services they need within their own community. And yes, there's going to be a cost, but I'm willing to absorb that in order to show them that life is important, both from the time of conception right through their children's growth. They need the support in their own community.
Thank you, ma'am.
Thank you. My name is Angela Weber. I'm just curious if there have been any rollbacks of any state or federal subsidies that have led to finding us in the situation that we're now in.
Is there a panelist who can answer that question? I don't know the answer to that. Yeah, off the top of my head, just general awareness. No, other than the fact that I can tell you right now, if anyone who's in healthcare, you've been in healthcare, reimbursement rates are completely eclipsed by the increasing costs in everything else. So our costs have gone up for everything, for medications, for supplies, the cost to care for patients. And I'm not speaking on behalf of the hospital. Let me just be clear. I'm speaking on behalf of the hospital district and many years in healthcare. So the costs continue to go up, reimbursement does not. And we're in a very challenging community from a reimbursement perspective. I've worked in New York, I've worked in California for over 30 years. And before I came here, and I love our county, it's a beautiful county, and look outside. I mean, for all the reasons we all live here. But I can tell you that from a reimbursement perspective, I mean, when any hospital is going to have a heck of a time operating in this environment. And it's not just for OBGYN services, maternity services, it's for lots of services. It's a very challenging, I'm going to use the term payer mix. That's the insurance reimbursements that we have in our county.
I know there's been a lot of discussion in regards to payer mix and reimbursement rates, and I don't want to call on specific physicians who are in the room, but it's not just Medicaid reimbursement rates. It's also just insurance reimbursement rates as well. And there are physicians leaving private practice, leaving just practice and opening up concierge practices because insurance rates just within OBGYN are not there. And if you're looking at our payer mix, yes, we do have a large Medicaid reimbursement rate in Indian River County, but also when we're looking at the cost of prenatal care, the cost of the delivery, and the cost of postpartum, insurance rates will not even get us where we're at. So it's why we are continuously operating at a deficit. I've been in maternal child health for almost 20 years, and I have said for all of those 20 years that OBGYN is a mission-driven service line. It always has been. And quite honestly, it probably always will be. But that's where birth, that's where life starts. And so if we're not giving children in this community a healthy start at the very beginning, then we're going to truly have a dying community. And so when we look at I don't want to just focus on Medicaid reimbursement rates. It's also insurance reimbursement rates as well.
Thank you, Megan. That's a great point.
Hi, I'm Heather Miranda with Treasure Coast Community Health. We're one of the healthcare providers in the community. I was thinking about the fact from a long-term perspective, when we don't have these services, do people decide not to live in our community? Do children not be born here and our community is not moving forward with more children so that we can support growth in the community?
Yeah, that's a legitimate question and Heather, thank you for all your service at TCCH. You guys do a lot of great work. I will say that that's a discussion that we've had. The problem or the unfortunate aspect of that is the impact of that won't be seen in weeks, months, or years. The impact is over a long horizon. So before you know you're in that situation, 10, 20 years have gone by, and then the question is, can you recover? But it's not for any community who loses maternity services, that doesn't say to young families, welcome, come here, we want you here. It can send the opposite message to your point.
Sorry. To that point, it also doesn't attract young teachers, young physicians, young nurses, young lawyers, any type of professionals to this community. When you're trying to recruit and retain the youngest and the brightest, you're not going to be able to do that if you're screaming from the rooftops that we do not have an OB department within our community. So we need to think about that from a long-term perspective as well.
My name is James Presley. I ran a private practice for 33 years here in town. I did almost all insurance or self-pay, very little Medicaid. I can tell you that I lost a lot of patients to Melbourne, Holmes Regional Medical Center because of their level 2 nursery, because they allowed VBAC, something called VBAC, which is a vaginal birth after section. I lost a lot of patients delivering down in Fort Pierce because of the same reason. So yeah, it's the whole idea of labor and delivery with people who have insurance. It's important about the quality of care and the level of nursery care and the level of support. If we're going to attract the young professionals and the white collar people here with insurance and money, we need to maintain not only obstetrical and maternity services, but also pediatric services. I'm not sure how many of you know, but our hospital here used to have an inpatient pediatric service. Did y'all know that? Yeah. We lost that back in the late 90s when the hospital decided it wasn't worth the money to keep it going. So from now on, if you have a pediatric emergency, you have to drive your baby down to Fort Pierce. But we lost that in the 90s. So not only is maternity care important, I also think inpatient pediatric care is important too.
Yes, ma'am.
My name's Debbie Schellenberger. I really hope that they keep the maternity ward open here for more than just that reason. I've worked in Philadelphia for 40 years in medicine, and every hospital that dropped its maternity ward eventually either was gobbled up or closed. And I don't want to see that happen here because it's not a good idea. I think that you have to look at different ways of making money, bringing money in. You know, whatever the hospital is really good at, push that out there, let people see it, let them know what you do well. You do a lot of things well. I don't think people know that.
Thank you.
Hi, I have to have, not very normal, for the new to this, I just found out about this.
Thank you for being here.
And I'm pretty sure that this is about money and insurance. But what I don't understand is maybe for the life of me, and maybe some other people who like me. What's Cleveland Clinic part in this? I'm sure Cleveland Clinic, and I'm not talking about this hospital, I'm talking about Cleveland, the clinic is not one branch. So what is their part in all of this? How does that interact? Because I know you're from the hospital district. He's here from active, visually fit.
Thank you for your question. We do have someone here from Cleveland Clinic and Dr. Fife, who's chair of the OBGYN department, will be at the next two sessions. Unfortunately, not here tonight, but we do have Mary Volsky
She's
here.
here.
Oh, is Dr. Where is it? Oh, Dr. Fife. Okay, but let me just say that I don't speak for Cleveland Clinic. We are the hospital district, but we're not part of Cleveland Clinic. I will say that I appreciate the question. I want to stay focused on our main questions today. I don't have an answer for you. And that answer would have to probably come from, Cleveland Clinic corporate. So I can't help with that question, but I appreciate it very much. Thank you, sir. Go on, throw it then.
Jenny. Hi, Kim Westcott, and I'm a community member. I'm on the board for CareNet. And some of the research that we've looked into, just in terms of our own information and for the women that we service at CareNet, indicates that there are 1,200 babies born to Indian River County residents, but somewhere between 400 or 500 of those are going elsewhere to deliver. And I guess my question would be, is some of that money that Cleveland Clinic's looking for, would that money go towards some of the things that Dr. Presley was talking about in terms of bringing those babies back into the community for service? So would some of that money be headed towards upgrading the obstetric services and maybe pulling some of that money back that they're losing, that Cleveland Clinic's losing due to babies being born elsewhere?
Thank you for your question, Kim. I can't, again, Mary, okay.
Sure.
1 second.
Thanks. So, I probably don't need the microphone. What I can tell you, and so Megan McFall, prior to being the CEO of Healthy Start, she was my boss at at Cleveland Clinic in Indian River, and I've worked with all these women before. We are currently in a remodel at Cleveland Clinic Indian River. We are spending $7 million to make it beautiful. And the people who, and let me tell you, construction, I told myself I would never, ever go through construction again after building a house. This is just as bad, but we're making our environment express the care that we give to all of our moms and babies. And our team at Cleveland Clinic Indian River Hospital is dedicated to ensuring the best health and outcomes to moms and babies. And wait, one more thing. This nice lady behind you, whose name I don't remember, I think you spoke and you asked about quality. And Megan actually has something I think she should share about the quality through the organization. Sorry.
I could talk about quality all day. I'm a data girl. Number one, there's a misnomer in Indian River County that Cleveland Clinic Indian River Hospital does not deliver the type of care that our competitors do. And I did work for Cleveland Clinic for many years. I no longer work for them any longer, and that was a hard decision because they deliver phenomenal care. And here are the stats. And again, I don't work for them, but I'm gonna go ahead and share the stats. Number one, everyone can go ahead and pick up this flyer right here. This flyer talks about Indian River County neonatal mortality rates from 2022 to 2023. This data is from our fetal and infant mortality rates. Every single month, Healthy Start has the ability to look at every single fetal and infant death that occurs in Indian River County. We have the ability to get medical records in regards to where these moms got prenatal care and where these moms delivered. From 2022 and 2023, the state average, the Florida average for neonatal mortality, and the definition of a neonatal mortality is the death of a baby born alive that died within the first 28 days. The Florida average is 3.95. On this form, you will see for those rates if you received care in Indian River County at Partners in Women's Health, which is a part of Cleveland Clinic in Indian River, your neonatal mortality rate was 0.81. If you delivered at Cleveland Clinic in Indian River Hospital, your neonatal mortality rate was 0.80. That shows that you are 80% better than the state average. 80% better than the state average. Number two, the NTSB rate, that's the primary cesarean section rate. That's for a first-time mom, term gestation, singleton baby, in vertex, head down. Cleveland Clinic Indian River Hospital has been nominated by the Florida State Surgeon General 3 years in a row, Mary?
3 years. and
3 years
Department of Health.
3 years in a row for having one of the lowest rates in the state of Florida. The other thing, we talk about a NICU, right? We talk about, well, Cleveland Clinic and Indian River Hospital doesn't have a NICU. You're right, they don't have a NICU. However, if you're going and you're getting consistent prenatal care, your provider is going to let you know if you are a candidate to be delivering at Cleveland Clinic Indian River Hospital or not. And if you're not, they're going to do a great job at setting you up at a Tradition or a Lawnwood or a Joe DiMaggio in Miami. But if you are, then do you know that your likelihood of you being separated from your baby is less than 2%? Meaning that if you deliver at Cleveland Clinic Indian River Hospital at our level 1 facility, the likelihood of you being separated from your baby is less than 2%, right in our backyard. So and I could go on and on and on about the phenomenal statistics right here in our backyard. And when people talk about, well, I choose to go outside of this county because the care is better. It is not. So that's number one. Number two, it's wonderful that women have a choice to go outside of this county. There are many women, especially the ones that we serve at Healthy Start, that do not have the ability and they do not have a choice to do that. So you're talking about those women who are then going to be relying on our EMS system and calling 911 for them to get to an outside county delivering hospital. And seconds count for these moms. Seconds count for these babies. I don't know if there's anything else from a statistical standpoint. Okay.
Thanks.
Thank you.
Megan, before you give the mic away, will you explain how that snowball affects, like the EMS system affects, like if they call 911 for their grandmother who might be having a stroke?
Absolutely. I mean, it's right. So let's just think about it. So if we have 1,200 deliveries in Indian River County, about a quarter of those moms are struggling with transportation issues. They take the GO line every single day to get to their prenatal appointments. Those are the ones that are going to be calling 911. Then our EMS system is going to be taxed with taking all of these moms to outside of our county to go ahead and deliver, outside. So that means that our EMS system is going to be outside of our county when you're calling for stroke-like symptoms, heart attack symptoms, a motor vehicle accident. And then our tax dollars are going to be stretched in different ways because our response time for our EMS system is going to be longer than what we're used to because we're now busy transporting all of these moms outside of this county.
Are they actually gonna transport them outside of the county, or do they have to bring them to our ER first and then be transported?
If they're over 20 weeks, we don't have an obstetrical department. They should be transporting them outside of our
That's a
county
big
to an OB
question.
department.
Is EMS gonna actually do that? Is there?
It depends on the emergent situation, right? I mean, I gave the example of
Right.
if you're shopping at TJ Maxx down the street of a 34-week mom and she has an eclamptic seizure, she's probably gonna be brought to our ER, right? And the only way to stop an eclamptic seizure is what? Delivery. So you're gonna have this general surgeon doing a C-section on a pregnant patient.
Correct.
And who's gonna be responding to that baby that's been without oxygen for how long? The ED nurses?
It actually gets even more complicated than that.
Trying to keep things simple, hear from the community.
Because if you have an obstetric emergency, but you have no OB doctors in the county anymore who have hospital obstetric privileges, then you're gonna have ER doctors trying to do things that they're not trained to do. You may have gynecologists in town who do remember their obstetrics from residency, but they're not allowed to do that because they don't have privileges in that. So it gets real complicated. So you may have a doctor in town who knows how to do a section, but haven't done one in 10 years. But the and general surgeon's never done one, but he probably does have privileges till he's operate. So it gets real complicated if you don't have an obstetrical service.
Thank you, Dr. Lindsay. Thank you. So more questions from our folks in the audience? Okay.
Hi, I'm Christy Crawford. I'm the one Megan was talking about. I am an GYN in town and I. But I just think that like I can answer a few of your all's questions and I think that I just wanted to give you like real numbers and data so you kind of understand. So in 1990, insurance companies had the idea that they could do what's called global packaging. And these global packaging could cover, many, like if you went to get your colonoscopy, that's gonna cover like your preoperative visit and your colonoscopy and all of that. Well, that's when for all of those services. That happened in 1990. So then let's move to 2009. That's when the Health Information Technology for Economic and Clinical Health Act came into place, which was now mandating for you to get reimbursement mainly from Medicare and Medicaid services. You now had to start using electronic medical record. You now had to be accounted for every I was done. When you go in and they ask you all those questions like, do you have a safe place to stay? Do you have food? Have you ever, all these extra questions and it's like, what does that have to? It's because you have to check the boxes in order to meet metrics, in order to get paid. Either the provider has to do that, the nurse has to do that, or you have to hire somebody else for that. So that's like raising the cost.
I'm sorry, I don't want to, we're limiting comments to 1 minute. I appreciate it, and we want to hear from the community, maybe the folks who don't work directly in maternity services, as part of this town hall. So 1
Let me
minute.
just tell them what the actual cost was. So currently for Medicaid, and insurance companies are only paying slightly above that because they have the ability to do whatever they want. Currently, for a Medicaid delivery, for 13 visits, your delivery and your postpartum visit, the hospital is reimbursed $2,689. That's it. For a cesarean section from the Center for Medicare and Medicaid, $3,020. That's it.
Ma'am, I'm sorry, I've got to stop you here, please. Thank you. Thank you very much for your comment.
I can just yell.
Okay.
Okay. Clearly, I'm an old person, so I can't speak for all old people. But as an old person, I'd like to say to the hospital district that I really do want you to support young families, mothers and babies. And I am happy, as maybe some other old people would raise their hand, to keep this community vibrant by supporting these services for mothers and babies.
I'm Dr. Michaela Scott, and I've practiced in this town for 45 years. And I was part of the committee that selected several of the hospitals. Actually, Cleveland Clinic would have not been my choice. But at the time, they promised that they at least do obstetrics and delivery for 10 years. And I think the hospital district sold us out to Cleveland Clinic. So you have to make sure that this is provided here. And regardless of cost. But I mean, the Cleveland Clinic is inefficient. They are not user-friendly. they still do everything through Cleveland, and I'm sure you've heard plenty of the complaints. They've destroyed our medical community here. So I know you are very complimentary of the Cleveland Clinic. Unfortunately, as a physician, I cannot be, but I think you have to force the Cleveland Clinic to continue. But isn't their contract? It's at least until 29. I mean, for 10 years. And I hope by that time, maybe they've lost enough money that they'll leave town. Sebastian, that's a wonderful competition for them to have. So the hospital district is at fault to have to have selected the Cleveland Clinic, and if they cannot do what they promised to do, then it's your fault too, and you have to make sure that they do what they are supposed to do.
Thank you, doctor. I just did want to make one clarifying comment, is that we are aware at the district that, we do have a 10-year agreement. The purpose of this discussion and asking the public is, with all the evidence we see in the nation, the state, and the counties, surrounding counties, we want to get ahead. Solving the maternity sustainability problem for our county is not something we're going to be able to address in 6 months. This is going to be, this will take us a year, this will take us time, and it's going to be something that we're 3.5 years out from the agreement ending, that's correct. But we definitely wanted to get ahead of it, and that's why we're having this discussion.
My name is Jessica Stewart. I've been here my whole life, 4th generation Vero Beachite. Born here, my mom was born here. It's home. I delivered all 3 of my children under the care of partners. And I really hope that you guys can continue the care here. It's super important for all of the reasons we have already spoken about. I'm also a labor and delivery nurse and very emotional and passionate about what we do here. I've been there 14 years and we have saved lives. And if you shut our doors, lives will be lost. So please, I urge you, I'm glad you started these meetings early and like you said, getting ahead of it, but give us a chance. We can turn it around. I know we can. And so if you want us to fix it, just God, give us more time. It's not enough time. So please.
Thank you. Thank you for those comments.
My name's Katie McDermott, and recently I did a clinical rotation at Cleveland Clinic as a sonographer. So I got to see these wonderful nurses at work, and I really believe that we need to keep the doors open. $3.5 million is nothing compared to how much we're spending on Oslo Road right now, so. And with that, more people should be coming into the community. I myself would love to work for Cleveland Clinic one day as a sonographer and take care of the women in my community. I have my son here with me today, who is the future of our entire community, so.
Thank you for that comment. And to that point, if you've never been, hopefully you will be soon. I will agree that down in Oslo Road and bringing Buc-ee's to our area will certainly, if you've never been to a Buc-ee's for one of their sandwiches, that'll help with the population increase, no question.
Hi, I'm Karen Mango, Karen's School Nursing. I have delivered both of my children at Cleveland Clinic, and I will have a grandchild delivered there later this week. Really excited about it. But I just want to say, I've had the privilege of working in the FEMA process with fetal and infant mortality. People will die, moms will die, babies will die. It is a fact. And if you have received a bill for taking an ambulance for 4 miles, that was $600. Trust me, getting one to go to Fort Pierce or Melbourne, it's a whole other, it's gonna be $3,000 a person. That's what I think about. But honestly, Megan has not really said what her agency does to address interacting with women. Everyone that comes into that hospital has the ability to be served by Healthy Start. If they're delivered in another county, it will be tracking them down to provide care and services that they so desperately need. And it could be lactation consultants, it could be whatever, not necessarily just low-income people receive those services. Every mom is supported in every way. And we have wonderful nonprofits that have stepped up to help address this crisis of the maternity crisis. Caring Center for Women is fantastic and is seeing women at the very beginning of their pregnancies, because our 2 offices that deliver babies are so full that you can't get into them for like the 17th week. When I got pregnant, I saw a doctor, like Dr. Presley's office, 6 weeks, 7 weeks. Now you call them, they're like, yeah, we'll see you in the 17th or 18th week. And Women's Care Center is seeing those women for no cost. Every woman in Indian River County that is pregnant can go there and receive her first 3 visits and all of her blood work for no cost. And these are things that as a community, we can address on our own. We have that ability. $3 million, $3.5 million is nothing. We can pay that. I will gladly say, take my tax dollars. I'd rather do that than buy, I don't know, lot sand on the ocean, to be frank. But, you know, I really think that we as a community, and it is, I am grateful for this conversation starting earlier, because in Martin, it didn't, and then they didn't have it. And so we need to be here. We need to be talking about it. We need marketing. We need people talking about this issue and people being aware. So thank you for all that you do.
Thank you very much.
Hi there, my name is Carissa. I'm a nurse practitioner at the Caring Center, and I just want to first say that when I moved here from Ohio in 2017, my first stop was labor and delivery. So I served my 8th through 13th year as a labor and delivery nurse there, and I can speak to the expertise and dedication of every single provider, nurse, ancillary staff that serves there. I have the pure joy of serving at a caring center for women, where I just want to give you some numbers. January through July, myself, Lori, and Laura, one other nurse practitioner that's not here tonight, just prenatal visits and their follow-up visit was almost 1,300 in number. That averages almost 200 a month. Those are the kind of visits we're doing so that we can assure that women are seen early and get the proper care that they need while they're waiting for a spot to open up at these practices in town that can serve them through the end of their pregnancy. The numbers speak for themselves. The need is great.
Thank you, Kristen. Yeah.
Good evening. My name is Cherie Frazier. I'm a nurse practitioner here. I was born here, been here all my life. I actually delivered at Cleveland Clinic back before it was Cleveland Clinic. My concern is I was one of those people who didn't want to have a hospital delivery. I was going to do the birthing center or at home. And then last hour, things kind of changed, right? So I was rushed to the hospital to have an emergency C-section. How does this closure affect birthing centers? Because they need to be within a certain distance from a hospital. So if we don't have those services available, how does that affect those birthing centers? Number one. And do they have any buy-in, the birthing centers, the midwives, into this discussion? And number two, as far as tax dollars are concerned, is there an additional tax assessment, or is this just allocating what local taxes already are?
Thank you for your question. So what I'll do is, even though he's not sitting up on the panel, I'll answer your last question, and then your first questions, if you could, Dr. Fife, would you mind answering? Please. So to answer your last question, so every year, the hospital district develops a budget based on our strategic goals, based on the community need that's identified. And this would be an additional, this would be part of our funding consideration altogether. So if you do the math just for a raw number, if you say, okay, if we were going to spend another $3.5 million a year, what is that like for real people? How's that going to affect everyone in the community? So that incremental increase based on our average home price last year would be about $40, $42 per person per year. Dr. Fife, would you mind?
I just want to repeat the question. The question, just to be sure that I understood, is what is the status of the birthing centers? I actually don't know the answer to that question, but the bottom line is that you are correct. there has to be maternity services at a hospital close by their birthing centers in the community. The hospital doesn't, as far as I know, doesn't, unless it's connected to them, doesn't have any responsibilities for those birthing centers. What it does is provide to the patients of the community access to care.
Thank you, Dennis. Gentleman by the window, thank you.
Hello, everyone. I'm Dr. Mahavir Huertas. I'm one of the doctors with Partners in Women's Health. The question, or more of concern I have for the board, addresses the basic, do we or do we not, right? If whoever's seen me with my medical students, I teach them that life is a gamble and we have to think of what's the best chance that we're gonna win. If we consider the 1 in 2 pregnancies are unintended, not necessarily not wanted, but unintended. Women of reproductive age, unintended, you didn't intend to be pregnant, yet you're pregnant. You live in a county that has the services but may not have it, that's gonna scare away people. So unintended pregnancies, you know, there's people that I didn't plan to be in a place where there is no obstetrics and gynecology, but now there's not, and I don't have it, and I cannot get transportation for the hospitals. They'll lose this service. Not only that, women have been underserved now for way too long. And if obstetricians leave because we don't have a job, then gynecologists leave. So women of reproductive age and more will be without service, or will have to travel even further to get their services. So to the question 3.5, is it worth it or not? Women should let us know. Okay?
The other thing that hasn't been brought up is that women in 80% of the households make all of the medical decisions in the family. So you're compromising all service lines in a hospital system if a woman doesn't deliver there, because the first time that a woman has comprehensive medical care, for the most part in their adult life, is when they're giving birth. And so if they have phenomenal care at that hospital system, they're gonna tell their dad, they're gonna bring their children, they're gonna tell their father-in-law to go have those elective procedures at that facility. And so when you're taking away the ability to deliver at your local hospital, you're also taking away the ability to be able to establish care for gastroenterology, joint replacement, cardiothoracic surgery.
Thank you. Please.
Hi, Meredith Egan, United Way. I wrote all these comments and you guys really nailed them all. I mean, EMS, all these things, minutes matter. Which brings me to, United Way invests approximately $3 million a year in remediating some of our community's most complex problems that can be solved if we were to invest more in children and prevention. So I want to go back to the very first comment that was made, and what's the long-term cost of this? Thinking about third grade reading scores, mental health issues, substance abuse, early childhood developmental milestones, the health of a mother, the mental health of that mother, divorce rates, all of those, oh my gosh, what's the word? Mine just blank.
Thanks.
The social determinants of health. Thank you, United Way. All the social determinants of health we know are connected, and that immediately connects to the economy of our community. We talked about, will people be attracted to want to live here? We already know there's an affordable housing crisis. If people can't find a place to live, if they can't find a place to work, and what's the second thing they ask? They ask about the school district. The next thing they're going to ask about is our healthcare system. Nobody's going to want to live here. Michael Kent said that this will be a dying community. It will be, absolutely. So thinking about what's that long term, we know we all want to serve moms, we all want to serve babies, but thinking about that long-term impact of our community and the remediation that this is gonna take in 10 years, in 12 years, in 20 years, our crime rates, the affordable housing crisis will only get worse, and it will all start with a healthy start, right?
Thank you, Meredith.
Thank you, Mary.
I just still led to, I can't leave here without reiterating the flood that will happen to our EMS system and our departments if we don't have maternity services. If you're still at risk for postpartum hemorrhage way after you go home, do you really want to be dropped off at the local emergency room hemorrhaging and there's no obstetrical person there to help you? You know, do you really want to be looking for a provider when there's all the providers are inundated with people looking for appointments because the person closest to you, is filled with people also trying to look for an appointment? And I'll just leave you with this. I remember a preacher told me one time where I was sitting in a church and I was listening to a preacher, and he said, if you go to a church and there's no children, you should leave the church. Which, same for a community. If there's no youth, there's no young people, you probably should get out of the community.
Thank you.
Hi, I'm Ali Cafeo. I'm the Student Services Director at CareNet. So I'm one of the young people that this will totally affect. And my husband and I have been married for almost 2 years. And we were closing on a house soon and dealing with all the property taxes and all those things. And as a young person, I think, what was it, like $42 a year, we happily pay that to not have this monkey wrench thrown into our community. And then also to have the confidence that with like the teens that we see, for them, they're already scared of like the unplanned dreams kind of being deterred and stuff. So I think having the labor and delivery here will just give them confidence. While they can have the choice, it gives them the confidence to also have the care that they need in a crisis, unplanned situations as well.
Thank you for sharing.
Thank you. Hi, I'm a local resident here and very pregnant, as you can see. And I was one of the lucky people who are able to have a choice. In my community, whenever anybody gets pregnant, the first thing you hear is, do not give birth in Vero Beach. And I do not know why this reputation happened. I do not see in data anything that really warrants it. But it may not be so much what Vero Beach is doing wrong. It could be what other hospitals are doing right. When I researched Holmes, Longwood tradition, especially when I had a very in-depth Torah tradition, talk to the doctors, the care I received there is fantastic and I wouldn't exchange it for the world. And I know that I'm in a lucky position being able to travel there and access it. So my question is, if all the hospitals continue to attract patients with private insurance, will that give the local hospital here any financial incentive to expand and improve the maternity services to keep them on the level like that? And a second question relates to the emergency situations. I guess the most recent comparison we would have is Martin North. So their closure of the maternity services, what outcomes has it had in the community? Is there any data or is there anything we know? Because it's hard to work off hypotheticals.
Indeed. Thank you for the question. Let me see if I could, Mary.
So I don't have the data of Mark North, but what I do know is that when oxygen is cut off to a baby, you got 4 minutes and 10 minutes before there's brain damage. And that it takes from here to get to Longwood at least 17 minutes. And that's the closest facility. I was born in Indian River County. I am born and bred, much like Jessica said. I was born in Indian River County, in the old hospital, they tore it down because I'm too old. And the only thing in my life I ever wanted was to be a mother, and that's the one thing I never got. And so I spend every day making sure that our moms in this community have the best care possible. Every person up here can tell you that every one of my caregivers are the same. The thing that I've gotten out of this meeting today, I'm gonna be honest, I was scared. I didn't know what the community was going to say, and the outpouring of people that recognize the importance of maternity services brings me joy.
Go ahead, Sam.
Hi, I'm Samantha Suffich. I'm the CEO for Martin County's Healthy Start Coalition. Hi, I recognize a few people. I don't have specific stories for you. Our labor and delivery closed in April, so I don't have a lot of very specific stories that I can share. But what I can tell you is that we're hearing of an increase of people going to Tradition, HCA St. Lucie, down to Jupiter. So now those systems are being overwhelmed and compromised. I know that Tradition has had a changing in staff, so they've lost practitioners. So my arguments to keep this here, don't be like Martin. So we did see an overwhelm, or we're seeing an overwhelm to our regional healthcare system. So it is a fundamental part of the community. It talks to the vibrancy and the overall community's health to have a strong maternity system. I would say it's even comparable to your ER. You know, having access to something that's so fundamental, it's critical. So my personal experience, I have 3 children. I live 5 minutes from North Hospital. It would take me about an hour, especially traffic like it was tonight, to drive to Tradition like Cleveland Clinic was wanting me to do. My 3rd child was born in 45 minutes. I wouldn't have made it. My baby would have been born on 95. So that's a problem. That's the reality that we're scared to see. And we know that studies have shown that there's an increase in travel distances, leads to higher rates of maternal complications, preterm births, and NICU admissions. So, and then you then see also the additional financial burden of those NICU admissions as that result. So Martin County is on this verge of becoming a maternity care desert. I really hope your hospital district can leverage this as an opportunity to not become like Martin County. You guys are very fortunate to have hospital district.
Thank you.
I think one of the things that in the 2 questions, just very quickly. Number 1, if you wanna, Martin, the closure, as Sam said, is too new. But Okeechobee has been a maternity desert for umpteen years. And if you go to Florida charts and you wanna know what their outcomes look like, because they're a maternity desert, they're above the state average year after year after year in regards to infant and fetal mortality. So that's what we could become. Number 2, Cleveland Clinic is investing in women. We just need some time, as to Jessica's point. They're reinvesting, the postpartum unit is done, labor and delivery is being done, and so we just need some time. We know that women's brains are wired differently, pretty equals good. And so we knew that we were behind the curve and that department hadn't been redone in quite some time. They're doing it, and so we just need some time to go ahead within our community for us to equal what all the other hospitals have done.
And that has been, that remodel, and let me tell you, it is gorgeous. I told you. Yeah, 2 seconds. It is gorgeous, but that's community has like pitched in to help us have the most beautiful maternity area around. And we are like supposedly opening the new labor and delivery unit in the end of December. That's a suppose.
Thank you, Mary. So we've got, one Michael, please. Yes, please.
Hi, everybody. I'm one of the old people. First, I wanted to thank all of the medical professionals that are here for the good work that you do and the care that you give. And also for starting early this conversation, which is so important. We live in one of the wealthiest counties in this country. what are we, why is this discussion even happening? Where? It says everything about who we are, the way we take care of our women and our families. We're talking about $42, a family that shouldn't even be part of the conversation, but I think there's some other way to look at funding this need. So I leave that question, like, who are we?
Thank you. You know, while we're at time, because this is such an important topic, I want to make sure that we give everyone a chance who'd like to ask a question, an opportunity now. If you have not asked a question already in the audience, do we have anyone else who'd like to ask a question? I'm sorry, I was looking at you. Okay. Here, Jenny, you got it.
Gail Chiuso, and I just wanted to state, I keep hearing infant mortality rates. I think another thing that needs to be considered, if you don't have OBGYN here in the county, and they're not getting those immediate services, what are you looking at for special needs assistance for that child's entire life if they don't come into the world properly?
Thank you.
Right. Well, we are one of the richest counties ever. We have the extremes in our county. We have the beach side that have like multi-billion, zillion dollars. But we have women that are living on dirt floors without secure homes. Our county needs this.
Thank you.
Hi, I'm Jerry Rourke, and I am the director of the Caring Center for Women. And I want you all to know that at this point, from January until now, we have 553 new pregnancies that will be at risk. And we're not even through the year. So they are counting on us, and we need to be there for them. So I thank you all for coming tonight. This shows the hospital district that you care, and it was important for this to happen and all of you to be here.
Thank you. So we have time. We'll do one more question. If there's no other questions, thank you very much for coming out tonight. Obviously, this is a bigger turnout than we expected in person and online. And just so grateful for your feedback. I mean, it's back to school week. It is back to school week, right? And I'm from New York, so school doesn't start till after Labor Day, but we've got, it's hot outside. Everyone's here for this important topic. Panelists, thank you very much. Trustees, thank you very much for joining us, and the staff who did a fantastic job. So you have, if you did not pick up this flyer on the way in, please do, and scan the QR code with your phone, and there'll be a survey. And you can fill out the survey so we can include more of your information, more of your feedback with our results we're going to present to the board next Wednesday. I'll also say that if for some reason you don't have a phone, no problem. We've got, and we have pens too. So this is the survey you can fill out, filling the circle, old school. So thanks again for being here. We're very grateful to have your input and feedback. Thanks very much.
That is right at a